It's time once again for a sponsored segment on First at 4 we call Medical Monday. On most Mondays, I talk to one of our sponsors from the medical community about the services that they provide. My guest today on Medical Monday is Dr. Craig Fairburn from University Oral and Facial Surgery. Dr. Fairburn, thanks so much for being with us today.
Thank you for having us.
Absolutely, it is my pleasure. Now, whenever we think about oral surgery and stuff like that, we're not talking about going in and getting your teeth cleaned.
Right.
You guys do very specific things.
That's right.
Who are your patients? Who needs to come and see you?
I would say it depends on what the needs are. Our patients vary from children who are born with cleft palates to maybe an elderly patient who simply needs a tooth extracted, but they have a lot of complicated medical needs. And of course we see what a lot of people think of oral surgery as seeing as teenagers who need wisdom teeth out, patients who are missing teeth either electively or unfortunately traumatically, and they need to be replaced with implants or something like that.
There you go, and so that's a pretty broad range of things. From,
it is.
You know, something that's I guess everyone's getting done now, having their wisdom teeth removed, to like you said, somebody that's maybe in a traumatic automobile accident.
That's right.
And they lose teeth, and you guys have got to go in there and kind of put the pieces back together.
That's right.
And you mentioned implants. What are dental implants, and how do they work?
Well, dental implants are basically screw-formed titanium devices that go in the jaw, and they can be used to replace either a single tooth, multiple teeth. They can be used in lieu of a bridge if someone's missing a single tooth, or they can be used for replacement of an entire arch of teeth if that's what's needed. Many times patients don't think they have other options other than wearing partials or dentures, and that's just simply not the case. They either haven't investigated it, maybe they had dentures placed 30 years ago, and they don't know that they have an option to have teeth that are fixed and can stay in place all the time.
And that's the real trick with the implants,
that's the trick.
Isn't it? Is that they're there. I mean, once you get them in, you treat them just like real teeth. You brush, you floss, and they don't go in a little glass on the nightstand.
That's exactly right. That's exactly right.
Tell us a little bit about a procedure like that where you get implants put in. Is that pretty major? Do you have to put people to sleep, or how does that work?
Most of our patients do like being put to sleep when you talk about putting something in the bone. We offer that to all of our patients, assuming that they're medically stable and can tolerate that. The procedure itself, universally, our patients tell us it's less painful than having a tooth extracted.
Really?
Yeah. And many of our patients will leave and that same day go home and they're prepared to eat soft foods and all of that for a week, and they're kind of disappointed that all the yogurt goes to waste because they go back and eat what they normally want to eat.
So the recovery rate's pretty fast.
It is fast.
Comparative.
It is fast.
So, and a lot of people have, you know, there's a stigma with going to the dentist a lot of the time, and especially if you're going to have something major done.
Right.
But I guess you don't necessarily have to have that with implants, right?
No, absolutely not. Most patients, everyone knows someone that has an implant. They just don't know they know that person. So,
really?
Yeah.
All right, super. And really quickly, we're running low on time, but let's talk a little bit about some of the new things that you guys are doing over there, technology-wise. What have you got that's neat?
Probably the biggest technology is we use a CT scanner to look at the bone before we have to go in and do the surgery and guess how much bone you have. And where that's important is it allows us to do the procedures less traumatically. We're also able to place implants into patients who have been missing teeth for multiple years. And even by a lot of dentists that may look at them and say they're not candidates, it's a good idea for them to talk to a specialist that has a lot more options in terms of different size of implants and different bone grafting procedures if they need to be done.
So using that scan, you guys know exactly what you're going to go in there and do. You're not going in there poking around and guesstimating.
No, that's right. There's not as much guesswork.
All right, super. Dr. Fairburn, we're out of time, but thanks so much for being with us today.
Absolutely,
our pleasure. If our sponsors sparked your interest, you can find out more about them online at uofsdocs.com or by calling 205-556-2323.